My name's Stephen Roller. I'm the Chief Clinical Officer at Primary Health Solutions, which is the federally qualified health center here in Butler County. Just like to talk a little bit today about who we are and what we're doing, some exciting things going on here in Butler County. So the mission and vision of Primary Health Solutions is to improve community wellness through access to quality, affordable primary health care. Our vision is to exist to provide primary health care, including education, so patients have the opportunity to participate in the process of improving their personal health status. In the future, we would like to be recognized in Butler, Warren, and Clinton counties as the provider of choice for integrated care. Just to give a little bit of a snapshot of who Primary Health Solutions is, in 2015, we had about 22,000 unique patients to our organization. Now, this includes those that have been seen for medical, dental, and behavioral health services within our organization. We provide these services to patients in Butler County and the surrounding areas. Of these 22,000 patients, they accounted for 69,204 encounters in 2015. As an organization, we've been growing. We added 6,017 new patients in 2015. That comes out to a growth rate of about 16% from 2014 to 2015. We added 11 new medical providers in 2015, 2 new dentists, an optometrist, an optician, a dietitian, and a clinical pharmacist to our provider team. We were awarded a federal grant in August of 2015 to assist in opening a new community health center in the Oxford market. We also were provided several significant private grants to implement 2 school-based health centers in Butler County, one in the Fairfield School District and the other in the Hamilton City Schools. Approximately 75% of our patients are Medicaid or managed Medicaid. 12% of our patients are uninsured, 7% are Medicare, and 6% of our patients have commercial insurance. Approximately half of those 22,000 patients are age 18 or younger. So we have a fairly significant pediatric presence in Butler County. There's some pictures here. This is a picture of our administrative office on 210 South 2nd Street up on the 2nd floor. This is a picture of our Middletown office on 1036 South Verity. Part of the reason we wanted to include these pictures is just to get people a visual for sort of what our physical facilities look like. Oftentimes I think there's a misconception that what we're doing and some of the spaces we're in may not be to the same quality as some of the other private practices, and we're very, very proud of our facilities and our operations. This 22,000 square foot facility up in Middletown is our largest facility and built in 2011. Very, very proud of that. This is the registration area for medical services up in Middletown. This is our waiting area for medical. We have express care there that's open for more urgent and acute needs, 5 to 9 in the evening and 11 to 4 on the weekends and on holidays. This is the pharmacy that we have in the facility here in Middletown, and that's open as a retail pharmacy as well as for our patients. You can see to the left of this picture is our dental waiting area. This is one of our large medical exam rooms. This could be used for more of a consultative visit if we needed to see a larger family for multiple patients, we could do that. Here's one of our dental exam rooms in our Middletown Health Center. We have 8 dental operatories that look identical to this. Nice electronic dental record that interfaces with our electronic health record. Our medical folks can know exactly what's going on with a patient in dental and vice versa. So there's much more integrated care for our patients there, better coordination of services so that patients are getting what they need. The dentists have access to what they need for patients that are seen at Primary Health Solutions as a medical patient. This is our Primary Health Solutions office in downtown Hamilton, the Ernst J. Bever Pavilion. It's on 210 South 2nd Street on the 1st floor. This is what one of the medical exam rooms would look like. We currently have 12 medical exam rooms here, and we're adding 3 more. This is our comprehensive lab. We provide vaccines for children, point of care testing to look for acute illness. This is our area where a lot of our staff and our providers sit and do documentation. Our medical records is housed in this area. Really just very efficient so that we can get patients in and out in a timely manner. This is our Hamilton West location, which primarily services pediatric and women's health needs. We have board-certified pediatrician, 2 board-certified family nurse practitioners there, and then Dr. Milton Trochet, who we just added in November full-time as an obstetrician gynecologist. So he had been working for us part-time 1 day a week doing prenatal services out of this location. He saw the need, we saw the need for increased services in our Hamilton market, so we brought him on full-time. So he's in this location 4 days a week, and then he's in our Bever location 1 day a week providing prenatal services there as well. Here's one of the exam rooms, nice bright paint on the wall, kid-friendly exam rooms, because we do see a significant pediatric population out of this location. This is the ultrasound room where Dr. Trochet can do ultrasounds for his prenatal patients. Can also do some minor procedures in the office. We're also the grantee for WIC in Butler County. So in addition to our 22,000 patients that we have, medical, dental, behavioral health, there's also 8,000 WIC participants across Butler County. We have co-located WIC in the Bever Center, in our west location on 903 Northwest Washington Boulevard. We also have a large WIC office in our Middletown location. We've expanded WIC services to Oxford in our new Oxford location. It really is, again, another way to try to get as many services in one location as possible. So folks can come in, if they're eligible for women, infant, and children's services, then they may also need to see a pediatrician or see one of our primary care folks. There's a lot of success stories we have where folks have either come in for medical, didn't know about WIC, and we were able to get them plugged into services there, or they were being seen for WIC, didn't have a PCP, had an urgent medical need. We were able to get them seen that day, get their behavioral health issue under proper care, get their medical issue under current treatment. And really, we have a lot of good success stories where those two agencies working together have really had a synergistic effect. So that's been great for us, and most importantly, great for the patients. In addition, one of the things that we at Primary Health Solutions have really been focused on is making sure that patients are getting a good value and a good quality experience when they come to Primary Health Solutions. As a federally qualified health center, we're evaluated every year. We have to report out metrics to the federal agency HRSA, Healthcare Resources and Services. They're the ones that we get a small portion of our funding from. We also have to report out the quality of the health of our patients, the cost of the care that we provide to our patients. So we were very pleased that earlier this year, HRSA announced that they were going to give out $63 million in funding for those community health centers across the country that were doing an exceptional job of increasing access for patients, providing good quality outcomes, and doing it in a cost-effective manner. So there are about 1,400 federally qualified health centers across the country. They gave out awards to 139. So the top 10% of those federally qualified health centers were able to receive an award for what they considered a high-value health center. We were one of several here in Ohio to get that award. And we actually were very proud that we received the highest level of funding from HRSA of any FQHC in Ohio. So that really hopefully helps show the community, validates to us what we're doing, that we're providing a high quality service to our patients, to the community. We're doing it in a cost-effective manner, and we're doing it in a way to get as many new patients in as possible. In order to expand that access, we're needing to expand some service lines and expand access points across Butler County. So one of the things that we have done, as I mentioned earlier, was we've hired Dr. Milton Trochet, board certified obstetrician gynecologist, to work for us full time, and he's accepting new patients at our Northwest Washington location, as well as prenatal patients in our Bever Pavilion on 210 South 2nd Street in Hamilton. Also in 2015, in February, we opened an after-hours service in the Middletown location called Express Care. It's staffed until 9 p.m. every day, Monday through Friday, and then 11 to 4 on weekends and holidays. They see patients for acute issues such as bladder infections, bronchitis, GI upset, earaches, the flu, fevers, if children need immunizations, poison ivy, rashes, things like that. Sports physicals we could do in that location, sinus infections, just a wide variety of acute issues. Obviously not emergent issues. Those folks would need to go to the emergency room, but for acute issues that you would normally see your primary care provider for, this is another alternative, not having to go to urgent care or the emergency room. The other thing we do have on site is digital x-ray. So if someone has a sprain or we fear maybe a fracture or something like that, we can get a x-ray done right there. It's read by a board certified radiologist, and then we can get those results back normally in about 20 minutes. Here's a look at our radiology suite up in Middletown. Full complement of x-rays there. And then they're red, but we partner with ProScan Imaging, and they do, one of their board certified radiologists will do all of the reads for us. And as I said, if we need something turned around very quickly, more of a stat read, we can get that back to us normally within 20 minutes. In addition, one of the services we provide to the community is our mobile dental van. We started this mobile dental van, a lot of support from the community here in Hamilton. The Community Foundation helped sponsor and fund the van initially. We've been using it over the last several years, primarily for school-age children. There's a huge need to expand access for dental services in Butler County. The 3 schools that we've worked with up until now have been Talawanda School District, Hamilton City Schools, and Fairfield City Schools. We work with their school nurses, with their administrators, with their school liaisons to make sure that patients get consents from their parents, that they're able to be seen and evaluated on the mobile dental unit, and then follow-up care is provided. So it's not just assessment of do they need fillings, do they need routine cleanings, what may be necessary, but it's a step further. And then once we develop a treatment plan, our dental director, Dr. Lisa Marion, does a phenomenal job on the van. She will call those children's parents, explain to them the treatment plan, and then move forward as we go back to those schools. Those kids miss less school. They're, start to get relief from the dental pain or potential treatment that they need. And then we move more to where it's more preventative. And then we can get the current dental issues taken care of and then get the kids on a more preventative plan so that they're getting routine checkups, sealants, preventative fluoride treatments, things like that, so that we can help improve the overall oral health of the Butler County area in Southwest Ohio. We've built a new school-based health center in Fairfield. They have 3 dental operatories in there. So as we transition the Fairfield students to the permanent site there in Fairfield, we will be looking to increase the capacity in Hamilton City Schools with the mobile dental van, as well as partnering with New Miami schools to get their students needed access to dental services. So on the van, van is sort of a misnomer. We call it a dental van, but it's a 42-foot motor coach. There are 2 full dental operatories on there, so we can do x-rays on there, preventative exams. If teeth need pulled, that can be done on there, fillings, sealants. Anything that you could have done at your dental, at a primary dental office can be done on the van. Then these kids are able to get back to school. Parents don't have to miss work. It really is a benefit for everyone. One of the other things that Primary Health Solutions, as with our designation of a federally qualified health center, we do have access to a federal program called the 340B medication program. So patients that come and see us at Primary Health Solutions, if they're seen by one of our providers, whether it's a medical provider, behavioral health provider, or one of our dental providers, they're then eligible for any medications that those providers feel are necessary. If they get those at one of our partner pharmacies, they can get those at a often much reduced cost. We partner with Genoa, which is a QOL healthcare company up in Middletown. We partner with Community First Pharmacy here in Hamilton. And then we partner with Walgreens throughout Butler County. So we have multiple sites for patients of Primary Health Solutions that they can get medications at a very reasonable cost. In addition to that, we saw that there was still patients that weren't able to or taking advantage of these pharmacies that we partner with. So we started a home delivery pharmacy in January of this year. So patients that have a hard time maybe getting to one of those other pharmacies, or it's just more convenient for them to have their chronic medications sent to their home, they can work with us. We will get that set up for them so that those patients get the savings that are available for the 340B program and maybe not have to use their scarce resources in gas to go to the pharmacy or things like that. As I've alluded to and mentioned, we do provide behavioral health for our patients integrated into our medical centers. So we have an integrated behaviorist in each clinical site, so Middletown, Hamilton West, Bever Pavilion here in downtown Hamilton. Oxford will have a behaviorist, as well as our 2 school-based health centers. So they provide quick interventions. They're able to assess a patient, see if there is any underlying or very apparent behavioral health issues, be able to start working with the patient or their families potentially to see about some quick interventions, setting some goals on how to make some progress with that very important piece of their health. And then if they need more long-term therapy or maybe a referral to a psychiatrist, those behaviorists work with our medical staff to really make sure that we can make that transition as seamless as possible. With our partners here in Butler County, Butler Behavioral Health Services, and then in Warren and Clinton County, we partner with Solutions Community Counseling and Recovery Centers. They have access to drug and alcohol counseling, treatments such as Vivitrol. We know there's a huge abuse problem with opiates and with heroin. We want to help meet the needs of our community and really get those patients the help that they need. So by partnering with these organizations, we can get them into services much quicker. Our behavioral health partners provide services such as home-based services, work-based, school-based programs, and those include the entire family unit if necessary. Each situation is individualized. The treatment plan is individualized for that unique patient and their situation. We did partner with the Boonshoff School of Medicine to start to look at, again, quality measures. Is our behavioral health model of integrating behavioral health right into primary care, what is that doing for outcomes for our patients? We saw with the data that they compiled and published for us that chronic disease, we see an improvement in chronic disease with this type of model. We saw statistically significant improvements in blood pressures, diabetic control, and body mass indexes. So for our patients that might have been overweight or obese, when we partnered them with the behaviorist and the medical component of that, we saw significant improvements in their weight problem, not compared to just approaching it from a medical standpoint. So another way that Primary Health Solutions is looking to expand and make a more significant impact in the community is opening these school-based health centers, one in Fairfield and then opening in March in Hamilton at Garfield Middle School. So Fairfield City Schools was the first fully integrated school-based health center in the country to have all services, so medical, dental, vision, behavioral health, all in one location. So that's something that as a county, as a community, as an organization, we're very proud of. We're making some significant strides to really reduce and eliminate barriers for many at-risk and medically underserved populations in our communities. One of the big ways that this will help not just the students, not just their families, but the schools and the communities at large, is that it will help to minimize the amount of time that these students miss class for medical, dental, and vision appointments. So there's a significant amount of time that's missed by students either because they're sick and don't have access to primary care, don't have access to dental, or they may be out because they're going to appointments at those to follow up on those issues. This will help to facilitate those students, family members, and staff of the school districts to be seen at their place of work, at their place of education, in their community, so parents aren't necessarily having to take time off work. And the students, once they're seen for a dental appointment, a vision appointment, a medical appointment, if it's okay for them to return to class, they'll return to class. Parents will get the information from the medical provider, the vision provider, the dental provider, letting them know what's going on. Now, parents are more than welcome to come to those appointments. The parents, before the students can be seen, have to sign a consent that the student can be seen for services in that location. But if for some reason they can't make it, the student will be seen, the information will be conveyed to the parents, and they'll be returned back to class in a timely manner. We'll also be opening, as I said, in Garfield late March when we have our open house, March 24th, grand opening, and then we'll actually start seeing patients the first week of April. So this is a look at our registration area at the Fairfield School-Based Health Center. This is a look, part of the waiting area, the Vision Center, where some of the vision frames are, where the optician will fit the frames to students and their families. This is another look at the fitting area for the optician and the optical tech. Here's some of the vision frames that we'll have to offer. This is part of the pre-test equipment so that we can get a very comprehensive look at the eye health of the patients that come through our vision center. This is one of the vision lanes. We have 2 vision lanes in the Fairfield Center. We also have 2 vision lanes in the Hamilton School-Based Health Center in Garfield. This is all electronic, all digital. All the findings that are found here will go directly into our electronic health record. So again, if a patient is seen in our vision center, the dentist could have access to look at that, as well as the medical provider, so that we have a more comprehensive look at what's going on. If a patient's diabetic, the medical provider may want to know what's going on with the eye health of that patient. So we'll be able to see consults in there. Here's one of our 3 dental operatories in the Fairfield School-Based Health Center. Again, completely integrated on our electronic health record, our electronic dental record. Here's a side view of all 3 of our dental operatories in the Fairfield School-Based Health Center. This is the panoramic x-ray that we have there on site. This is one of our medical exam rooms, so we have 3 medical exam rooms as well in the Fairfield School-Based Health Center. We will have 3 in the Hamilton location as well. This is our behavioral health consultation room. A lot of our behavioral health encounters happen right in the medical and or dental area so that we see the patients right where they're at. But if there needs to be a little bit, maybe a group discussion or a family consultation, we do have some space to where that can happen with our behavioral health team. In addition to our school-based health centers, we did receive a grant to help with the initial startup of a Oxford Community Health Center. So we're very excited to be in the Oxford community. Our location is at 10 North Locust Street. We found out in August that we would be approved to open that location. So we have worked very diligently since August to get that up and running. We remodeled the space. It's about 4,000 square feet of office space. There are 6 medical exam rooms. We have the WIC offices co-located there, and we have 2 behavioral health rooms. We currently have a family nurse practitioner and are recruiting for a family physician to be in there as well. Our hours currently are Monday through Friday, 8:30 to 5, with plans to expand to evening and Saturday hours as well. We do know that there's a need for expanded dental access in Oxford area. We are putting some plans in place to have our mobile dental unit potentially do some Saturday hours starting in the spring and summer up in Oxford. One of the things that as an organization we do, and we're really excited to bring to Oxford, is we provide open access scheduling. So as patients are discharged from McCullough Hyde Hospital, have ED follow-ups, and they need to get into a primary care provider, if they don't have one, then we are happy to see them, and we can routinely get them in for that follow-up care within 24 to 48 hours after hospital discharge or discharge from the emergency department. So this is Suite A, 10 North Locust Street. This is the outside of our new office up in Oxford. Here's our waiting area. This is one of our medical exam rooms. As I mentioned, we have 6 total to accommodate our full-time family nurse practitioner as well as our family physician that will be coming on board. This is our lab. So we do participate in the Vaccine for Children's program. So any kids that need their vaccines and are a patient of Primary Health Solutions will be able to get their vaccines here on a regular basis so that we make sure that all of our patients are fully immunized. This is one of our behavioral health offices in the Oxford office. Again, a lot of our behavioral health will be done in the medical exam rooms, but if they need to do some follow-up in a behavioral health office, we can do that here. One of the other things that Primary Health Solutions is doing and really focusing on, we've really made a concerted effort over the last 18 months to look at the management of the health of our population. And our population can mean several things. One, it means the population of Primary Health Solutions. So the patients that already call us their patient-centered medical home, but then also the health of our community. So we enlisted the help of a data analytics software program that works with our electronic health record and really allows us to look at really mine the data of the health and the wellness of our patients here at Primary Health Solutions. So we can look at very specific measures, how many of our diabetics have been in the last 6 months? Have they had their lab work? Have they had their dental exam? Have they had their eye exam? To really make sure that all of our patients are getting all the services that they need. We create quality dashboards for each of our providers, including our dental providers. We look at each practice, we look at the organization, and then as we move out, we're going to start looking at the overall health of Butler County and beyond to see how can we partner with other organizations to improve the health. And we do that already through things like the Butler County Infant Mortality Initiative. Primary Health Solutions as well as Butler County WIC are some of the lead partners in that here in Butler County. We're working with the health department, other providers in the community to really make sure that we can decrease the high rates of infant mortality that we see in Southwest Ohio and Butler County. So again, a big change that's coming in healthcare is traditionally received reimbursement for the number of patients that you see on a daily basis, monthly basis, and that's changing. The Centers for Medicaid and Medicare Services say that by 2017, about 90% of all reimbursements will be value-based. So they're no longer going to say, you saw 100 patients this week, this is what we're going to pay you. They're going to say, for the 100 patients you saw this week, how well did you manage their diabetes? How well did you make sure that they were vaccinated? How well did you make sure their asthma was controlled? So this eye-to-eye systems is making us one of the leaders in the community, making sure that we're not just seeing patients, but we're providing the highest level of care to Butler County residents. It allows us to be much more innovative and proactive in developing and implementing new initiatives that will benefit our patients. Things like home-based primary care. If patients can't get in to see us in one of our brick and mortar locations, can we target those folks and do home visits to make sure that their asthma is being managed, that they're getting their well child checks, that they're getting their prenatal checks, all the things that need to be done to ensure overall health and wellness in Butler County, that we're providing that to the community. Another way that we have shown our community, shown our patients, and shown ourselves that we are committed to high levels of quality is becoming a patient-centered medical home. So we're NCQA Level 3 certified as a patient-centered medical home, and we have been since 2011. We were one of the first FQHCs in Ohio to be certified at that level. We are currently implementing a patient portal so that our patients have easier communication with their providers and with our organization. And we will be recertifying here in 2016 already so that we're compliant with the new standards that NCQA has put out for what a patient-centered medical home looks like. We are adding additional patient care coordinators and chronic disease management nurses to help in improving care for all of our chronic disease patients, but one of the specific areas we're going to focus is we have over 4,200 diabetic patients. We're going to start managing those patients, helping to enroll them in this chronic disease management program, getting them plugged in with all the services that they need so that the diabetics that come to seek care, primary care at our health centers, are the best cared for diabetics in Butler County and beyond. In addition, trying to make sure that we meet the needs of our patients, our community. We partnered with New York University and Lutheran Medical to create a dental residency in July of 2015. So we currently have Dr. Hill. He's the dental resident that we have in our Middletown location. He's been with us since July. He will be with us through the end of June of this year. And we're very happy. We've already successfully matched with our next dentist. So we know who our dental resident for 2016, 2017 will be. Just a way to introduce them to the Butler County community, to what we're doing in community health centers, to our patients, and hopefully as we expand our dental program in Butler County, provide us with a nice network of dentists that want to stay in this area, invest in our communities, and stay here long term. We've worked very hard over the last several years to reach out into the community, to provide community engagement opportunities, other nonprofit organizations, community members, other healthcare providers. We've partnered with a lot of good folks. We've done some women's health conferences here in Butler County. We put on a men's health conference and wellness conference. We partnered with another FQHC from Cincinnati, did it at Dave & Buster's, had a lot of old Bengals, Reds players. Really just a great opportunity. Men don't historically focus on their health as much as women do, and we wanted to help educate the community about the need to get engaged in your own health care, some important topics in men's health, and we're going to be doing more and more of that in the months and years to come. And then this is just a snapshot of who we are here at Primary Health Solutions. As I said, we've grown in number of patients, in number of sites, and also in number of staff. We're now at about 150 employees, continuing to grow at a fairly fast pace. So hopefully you recognize maybe some of these smiling faces in this picture, and if not, we would be happy to have you as a patient and introduce you to some of these great folks that we have here. Thank you.